Your practice actually is going to do over $2 million in collections this year. One of the big things that drove that is that you went from an average collection per patient of $1,600 and now over $3,000, which is a really solid number.
I think that the difference is we are huge on true comprehensive care. We're not kind of patchworking. We're not doing emergency only. Like we're truly trying to take them from where they're at and let them know exactly what's going on in their mouth and working them through that comprehensive care plan, because sometimes patients start it and then they never finish it. So they might have a large treatment plan or a $3,000, $4,000 treatment plan, but they're never getting all the way through it, so you're not appreciating it on the practice side of things. So I feel like for us, in a more out-of-network fee-for-service model, you have to give them a way that they can afford the increased cost. Now, some plans, that might be negligible. It might only be 5 or 10% more, but for some plans, it's substantial. So you need to be able to take the focus, like you said, off of insurance, focus it on how it is going to be attainable for them. And I feel like that has really helped our conversion rates.
Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. And today I have a very special guest, one of our clients, Dr. Jancy, out of Chattanooga, Tennessee, and she's going to be sharing how she took her average production per year from $1,600 to $3,000 per patient. That's humongous. Her practice just recently closed over the $2 million a year in collections, and she's going to give you step by step on how she did it. This is super golden information. And as always, make sure that you check out our sponsor down below, Cherry. They do an amazing job. She uses them. And this is one of the core pieces that she uses to help get growing the way that she wants. If you want to grow, go check them out. There's special pricing down below. Stay tuned for this one. All right. So we just had a really good conversation, and I'm super excited to talk to you about this because your practice, you got a new building, which is stressful, right? You're just like, I'm going into this new building and we got to do all these things to make things work, and you're going to hit your number. Your practice actually is going to do over $2 million in collections this year. And one of the big things that drove that is that you went from an average production per patient of, or is it average collections per patient of $1,600, 2024, $1,500 and change. Yeah. And now over 3,000. And this is over the year, right? So it takes time for that number to add up. And 3,000 per patient, which is a really solid number. And that means your patients are happy. That means your team's happy. That means you're happy. You're hitting your numbers. And we were talking about like how you did that. And one of the things is with how you're presenting treatment and using patient financing. So I would love for you to share how you're doing that and making sure everybody wins in the process.
Oh, yeah, absolutely. So we have a phenomenal office manager that's been in dentistry like 28 years, and she actually does all of our treatment coordination. That's one of the hats that she wears because she's phenomenal at it. And she started off as an assistant, so she's very clinically versed, so she understands the procedures, and she can explain it to patients because inevitably, all of you know, when you leave the room, all the questions come out. So when your treatment coordinator is going through things, they can really start to talk through those nuances and those questions that patients really have that they don't ask you for whatever reason. So one, we have a really qualified person, but she was the same person that was doing it in 2024, and our numbers have doubled. So with that being said, Taylor, one of the coaches at SMC that we worked with for the last year or so, she had recommended to us, because we use Cherry, we use Sunbit. We don't really do a lot of new care credit applications, but we do honor it if patients come in and have it and they want to utilize it, of course. But what we do is when we get a treatment plan in the back, before the patient is ever leaves the operatory, the hygienist, myself, my husband, whoever is going to go to Josie and give her a little bit of like a debrief, not in front of the patient, on like, hey, here's where we are. These are some concerns if we know what those are. These are priorities. This is how urgent it is. We're going to kind of do that unofficial handoff. Then she'll say, okay, let me pull everything. When she's pulling everything, she is going to go to Cherry, typically, because she likes its portal. And it has a little estimator. And you can do pre-qualification for patients sometimes, It's kind of like how we all get pre-qualifications from credit cards in the mail. It's not actually, doing anything to their credit. But if we can get a pre-qualification, we will. If we can't, we'll use the estimator function in these portals, and it'll at least print out usually options from as little as 3 months all the way to 60 months. And it'll say whether there's interest or not. So it gives the patient, a list of kind of budget friendly monthly options. So that way, by the time we move them into the consult room and she's sitting down face to face with them and we're doing a proper handoff, so to speak, in front of the patient, she already has their treatment plan. If they're utilizing insurance, whether in or out of network, she has that aspect, but she also has this monthly breakdown so that they can know that financing is available and that this is something that can fit into their monthly budget if finances are a concern. And we're not having to wait and hope that they voice that that's a concern, because a lot of patients are hesitant or they're embarrassed and they don't want to be forthcoming with that. So that way, if we're leading with it, it makes it very easy for them to be like, well, I'd like to do this because this seems like this is more doable for me. So that's kind of the evolution of how we've moved into that. And we've been able to close a lot more treatment by doing that. And it just lowers kind of that barrier for patients and puts them in a more comfortable position to say yes.
Okay, that's awesome. So you've seen massive growth from this. Now, I know what doctors are thinking out there. They're listening to this and they're saying, yeah, but you're paying this cherry fee, right? And patient financing isn't free. It costs money to do that. Has the growth made up for the fee?
For me personally, yes. And Cherry, I will say this about Cherry. Cherry, the fees are typically less than like with Sunbit. And Cherry, depending on how much volume you do in your practice, those fees to you can change. So the more volume you do, the better it is for you. So there are some strategies to be able to help that number on the admin side of things. But I look at it this way. Um, if a patient comes in and they can't afford treatment and they would typically say no, then I've lost $3,000. That's my average. I might have lost 5,000. I might have lost 1,200, whatever it is, but my average is 3. So if I lost 3,000, then had I rather lose 3,000, or let's say with my worst Sunbit hit, it's 15% if a patient has a really bad credit score and they're a high risk patient, right? But 15% of that is a few $100s. Had I rather lose a few $100s, or had I rather lose $3,100? Do I love it? No, it doesn't give me warm fuzzies. So I understand the barrier and the struggle for dentists. But when you really step back and take your emotions out of it and look at it from a numbers standpoint, then typically, if you're doing enough collections and volume and size cases, it's going to offset the administrative fee that you're having to, kind of bite the bullet to get there. Personally.
Got it. Yeah. Okay. That's really, really helpful. And that's how I think through it too. But I kind of know the obstacles that people bump into. So I appreciate you breaking that down. Now, the other side of it is a lot of times dentists are like, wait, $3,000, I'm only doing $1,000 a year on a patient. Are you over treating? Are the patients not happy at the end? How happy are the patients that they can actually get the treatment done in your experience?
Well, I feel like that our referrals and our referral rate and our Google reviews kind of speak to themselves that we do have happy patients and they are sending their friends and family. So I feel like if they were leaving with a bad taste in their mouth, then they would not want to send their friends, and they wouldn't. We all know people love to tell Google everything. So if they were unhappy, they would tell them that too. So I feel like that, since those two things are trending in a positive direction and our referral numbers are high, then that is, speaking to that patients are having a good experience. They're telling their coworkers, they're telling their family members. My husband and I are actually pretty conservative. Sometimes we get second opinions from other offices, and sometimes our treatment plans are less than others. I think that the difference is we are huge on true comprehensive care. So we're not kind of patchworking. We're not doing emergency only, like we're truly trying to take them from where they're at and let them know exactly what's going on in their mouth and working them through that comprehensive care plan, because sometimes patients start it and then they never finish it. So they might have a large treatment plan or a $3,000, $4,000 treatment plan, but they're never getting all the way through it. So you're not appreciating it on the practice side of things. think sometimes that's an issue. Also, to be noted, we are only contracted with 2 insurances. So a lot of ours is out of network. A lot of it is our fee. So if our crown fee is $1,600 or $1,700, $3,000 is 2 crowns in a year. It's not that much. So I think that fees play into that. Your insurance, plays into that. If you're doing truly comprehensive care and continuing to take them through the model and then not getting stuck somewhere, whether they get referred out. We do a lot of things in house. My husband and I both did. I did a 2-year general practice residency that was very sedation surgery heavy. He did the same program for a year. So we do a lot of sedation. That's going to increase our kind of price per patient. He does a lot of Invisalign. I do a lot of cosmetics. So we do refer out some, but if we're keeping a lot of that in house because we've had extra training, it is going to drive up our treatment plans where it might not in everyone's office. So I think those are factors that we all need to consider when we're talking about what that number is.
That's so good. That was such a good explanation. I've learned a lot from that. I appreciate you sharing that. So, okay, now one thing that I've noticed about when offices use Cherry is that insurance becomes less of an issue, especially if you're not a network like an office like yours, because you're kind of taking the power away from the insurance company which is the conversation of like, how much do I got to pay out of pocket? The conversation goes to, this is how much you have to pay a month, and insurance becomes kind of irrelevant. I mean, they're going to cover something, but it doesn't really. Here's what insurance is covering. Here's what you're going to be paying every single month for the next X amount of months. Has that been your experience?
Yes. So I feel like for us, in a more out-of-network fee-for-service model, you have to give them a way that they can afford the increased cost. Now, some plans that might be negligible. It might only be 5 or 10% more, but for some plans, it's substantial. So you need to be able to take the focus, like you said, off of insurance and focus it on how it is going to be attainable for them. And I feel like that has really helped our conversion rates. And to go back to what you said about, some Cherry plans, you're taking 5%, some that for a fairly unqualified patient, you're taking 15%. So whatever that might be, 5, 10, 15, somewhere in between. As an out-of-network office, I don't mind taking that Cherry hit because if that's 15% of my fee, I'm okay with that because my alternative is if I'm in network, I might be writing off 49% with Delta Dental. So I look at it that way. Had I rather have an out-of-network fee-for-service cash patient at 5, 10, or 15%, or had I rather be driving insurance from Delta and writing off 50% of my fees? So that's another layer to look at when you're talking about your financing cost versus, you were going to be losing that being contracted with other insurances. And then they're going to be dictating and driving what you can and can't do, whether that's what's in the best interest of the patient or not.
You're a cheat code because you're a dentist, but your dad's a financial guy. So you spit all this out and I'm just like, what? You're not talking like a dentist right now.
I put my CPA hat on for a minute. I've listened to that for 39 years here on Christmas Eve. So, and definitely learned a lot from him in the last July will be 7 years since I've been in ownership. So, I do look at numbers a little bit differently, and it's easy for us as dentists to get really emotionally tied to our numbers because we feel like dentistry and being a dentist and being a good dentist is a lot of our identity. And I'm not saying that that's wrong, but sometimes business decisions don't need to be emotional decisions. And we need to step back and look at them a little bit more objectively, like someone that's in business or finance would, instead of just it feeling very personally tied to us, because sometimes that can cloud our judgment a little bit.
That's so cool. Good job. And I love your mindset, Dr. Jancy. That's why I wanted to have this podcast. And the last podcast, we got a lot of positive feedback. I know some doctors contacted you, and
that was very cool to get to kind of reach out and have some full circle moments and compare what other providers are kind of going through in their practices and how some of us are really living very kind of parallel paths, and being able to talk with each other and feel like we're kind of not in these little isolated practices and we're the only one that's living it. So it's nice to have a community to be able to learn from and draw from. And it works both ways. I love being able to learn from other offices because as long as you're practicing, there's always some growth and evolution that can take place.
Love it. Thank you so much for coming on today, Dr. Jancy. That was wonderful.
Absolutely. Thanks for having me again, Gary. I appreciate it.